Piece by piece, members of the Lewiston Commission are learning more about the events leading up to the shootings. 18 people were killed, 13 were injured when a shooter opened fire, first at Just-in-Time Recreation and then at Schemengees Bar and Grill. Today, in an online meeting, commissioners spoke with a mental health expert from the U.S. Army. News Center Maine's Caroline LaCour sat in on that meeting and explains what they found out. Caroline?
Yeah, Chris, while today's meeting was a brief one, members got a better understanding of the protocols of care if an Army reservist experiences a mental health crisis and what possible resources were offered to the Lewiston shooter.
They really have the ability to reach out and get them help. And that's the message that I want to get out to the team.
Members of the Lewiston Commission hearing from a U.S. Army doctor Thursday morning got some clarity on the protocol when an Army reservist experiences a mental health crisis, potentially mirroring the resources offered to Robert Card months before the mass shootings in October.
We are just one tool in that toolbox to help take care of that service member.
Answering members' questions, Dr. Mark Ochoa explained the Psychological Health Program, or PHP, designed to connect reservists with available resources, something he says can vary based on location, duty status, and insurance. If in active duty, he says a commander is the one to start the process of an evaluation.
You
Yes,
can report to their commander that they're non-responsive.
Oh, yeah.
Okay.
Yes. Absolutely. That's part of accountability.
But commissioners quickly expressed their concerns about the follow-through when it comes to care for a reservist not on active duty and potential gaps in communication.
At that point, that commander may or may not have any oversight because they can't make the person go, correct? Because the person is now in drill.
Ochoa says while PHP connects reservists to local resources, the state of Maine does not have a military hospital, leaving some reservists to find care at a civilian facility. If that happens, he says commanders aren't informed about the reservist's condition until a release form is signed.
Even if they're still under orders, it's the soldier's willingness to share information with their commander which controls. And if they're not willing, then it's not shared.
Check.
Now today, members explained today's questions were not able to touch on the specifics regarding Card during his time in the reserve, but an upcoming meeting, members will speak to the two Army personnel who can touch on some of those unanswered questions. Chris?
Another piece of the puzzle. Thanks, Caroline.